So the greatest thing about dermatology is that we can look at a patient and screen the patient and see something on the patient and then put our dermatoscope on that something. And then from there, even if we're not seeing something specific, we can scan high-risk areas. And sometimes we're surprised that we see, for example, this basal cell carcinoma right here on this patient that surprisingly you cannot see it without putting your scope on this nose and looking for such a thing as this. And so this is the basal cell carcinoma that I think is fairly clear in this situation. And the nice thing is then we can just mark it, outline it, take the biopsy, which is seen in this section, and then actually if we're certain it's basal cell, we can even take a thin layer of Mohs and then come to the microscope and check under the microscope and see, in fact, that is a basal cell carcinoma, and we can actually have evidence that can be seen by all of those that are present. And so one of the advantages of the teaching situation that we set up here is that we can have more than a few people in the room, even though it's a side-by-side, face-to-face microscope. We can also see from that angle. So the great thing that I love is to be able to look at a patient, to be able to find something even if you can't see it on such high-risk patients, take the biopsy immediately with in-house fresh frozen sections, evaluate it under the microscope, share it with the class, and then do a layer of Mohs surgery, evaluate the margins, clear the patient, and very simply take care of everything in just a short period of time with what ends up being a relatively shallow excision that will heal relatively nicely.